Pittsburgh. My mom and me moved to Fort Lauderdale when I was a kid. She wanted to go to the Keys, but the car broke down in Fort Lauderdale, so that's where we lived for a couple years. And I lived in the back seat of it was called a Cricket. That's the type of car it was. We were close to the beach. I'd shower at the beach because there were showers there. People would leave soap. I've stayed in quite a few Salvation Army shelters when I was a kid. I remember getting blocks of government cheese, and I would go fish in canals and pull out blue crabs, and we could boil those in a pot of water with a little fire that we'd make. Fortunately we were in South Florida, so it wasn't too cold. The most lucrative thing I learned to do, I would catch little tropical fish, and sometimes I get a queen French angelfish or little sergeant majors, and if they were cute, get a couple dollars for a sergeant major, sometimes up to 20 for a queen French angelfish. They were considered rare. And some days I'd make over $100 as a 7-year-old kid, bring it home to my mom who was cleaning motel rooms. And it wasn't long after a few weekends of doing that we were able to afford an apartment with my mom, who worked at a hospital in the cafeteria.
Tim's unique past has afforded him such a tremendous outlook on life. He's a warm, humble individual that's incredibly bright and has a unique background that brings the empathy component into what he does.
I've seen him buy patients medications, and I've also seen him, when if a patient was kind of stuck here for a long period of time, and go down and get them a magazine or, get them their favorite treat.
My relationship with Dr. Connelly started 11 years ago when I was hospitalized here at Memorial for kidney failure. I was his patient in the hospital. He's my primary care, and now I'm the practice manager here. So we're full circle. His bedside manner is awesome. He's funny, first of all. He really relaxes you. He's very informative. He's caring, very, very, very caring.
I couldn't go right from college to medical school. I worked construction when I was in college to help pay for undergrad. I couldn't borrow enough money. So I went to PA school at Nova Southeastern, and I worked for 5 years as a physician assistant in Central Florida. I lived in a small apartment, and I just saved my money for 5 years until I could go to medical school.
I've known Dr. Connelly and worked with him actually since he was a resident here. He always looked at a way of how can we work together to deliver healthcare more efficiently and effectively. Always over and above, and his energy is just endless. But that inspires others too. You definitely want to be like him. He definitely inspires you to want to do more. I don't know of anyone who has transformed healthcare more than him.
My passion and my love is teaching and training the next generation of physicians today. So I'm the program director of our transition year that we're bringing on this year, and I still continue to be the associate program director here, and I still see patients every day, both in the office and in the hospital, because I believe that's extremely important.
Number one for me is actually opening up this world of what internal medicine is. I give credit to Dr. Connelly for helping us understand that. And I would say that the one core aspect of how my medicine has been shaped by him is how I connect with people. COVID-19 was here, and not knowing the exact guidelines of what to do and what to treat. Dr. Connelly was very innovative. Working with him, we developed a vitamin D protocol. So we were very early pioneers in terms of understanding the importance of vitamin D.
When COVID hit us, there were 4 or 5 days where I never left the hospital in a row. I didn't go home. I rarely saw my family. But we were able to get so many people through that crisis. Lots of young women who just had C-sections that were severely ill on ventilators. There wasn't enough nurses, there wasn't enough doctors, but we were able to get through that, and we saved a lot of lives, and I was very proud that I was able to be a part of that.
He loves people. Whether they're patients, his partners, his residents, the staff, whatever, it doesn't matter. He just loves people, and he loves to be able to give to people. He's a wonderful teacher, he's a wonderful mentor for the residents, but he's also a lot of fun. I don't think the man sleeps.
Hey Tim, from all your friends at Memorial Health, congratulations on being the 2025 GHA Physician Hero. I can't think of a better recipient.
You are an extremely inspiring person that I am very honored and privileged to have had the opportunity to work with as many years as we have worked together.
Tim, thanks for all you do for us as a department, as a hospital, as a community. I couldn't do this job without you, and I wouldn't want to.